Hi, my name is Abhikesh Kumar. Today I'll be doing an insertion video for an IV. So today I have a doctor's order to put in an IV order. I'll be first going to the patient. First I will do hand hygiene. Knock on the door. And then I will close the door for privacy. Hi, can I get your name and date of birth? Jane Smith, February 18, 1990. I'm just gonna check the arm, for the armband. Okay, so you have a doctor's order today for an IV insertion for a blood transfusion. Now I'm just gonna get my equipment ready. Here I have my IV kit, my normal saline, my 18 gauge, and then my tourniquet, my alcohol pad, and my Tegaderm. Now I'm just going to start putting on my gloves. And I also have my sharps container. Before I begin, do you have any allergies? No allergies? Okay. Before I do that, I will prep my IV. I'll first insert some normal saline. I'm just going to flush out any air. Just to push. Okay, I have that ready. Now I'll apply the tourniquet 4 to 5 inches away from the IVs. Now that I have the tourniquet applied, I will check for distal pulse. So I see a +4 bounding. Now I'm just going to clean the area. If I was using a CHG, I will be going in a back and forth motion. Since I'm using an alcohol pad, I will be going in a circular motion. Or if I'm using a poivadine. Okay, now that I have that drying out, now I'll get my 18 gauge syringe. Once I take that out, I'll make sure that the bevel is upwards and I also having the white part upwards. Now I'm just going to pull the skin back about 1/4 inch. Now once I'm inserting it, I'll wait for some drawback. I'll see some blood. And then once I see blood, I'll start going to a flat motion, inserting it. Then with my hand, one hand, I'll push the CAD and hold it with the other and drag the needle. Now with one hand, I will apply the Tegaderm. Just above the site. And I will take off the Tegaderm. As you can see also if there's patent. Then I will check for Then I'll aspirate for blood and then push the normal saline inside. And then I'll empty this out and clamp it. Now I'm just going to label my Tegaderm with my date, with today's date. My initial, the time, and the size of gauze that I used, which was an 18 gauge. Just take the tourniquet off. Apply the tape. Then I'm just going to tape this above. Now last, if there's any pain, if there's any type of swelling or infiltration on the wound area on the IV site, then I'll clear up my area, put my stuff in the sharps container, and now I will document what I did for the patient and see if there's anything surrounded with that. Thank you. Hi, so my name is Abhikesh. I am here to discontinue an IV. I am in my Nightngale scrubs and my ID badge. So now I'm going to perform hand hygiene. Knock to my patient's room. Close the door, provide some privacy. Hi, can I get your name and date of birth? Jane Smith, February 18, 1990. Double check with the wrist. So I have an order from the doctor to discontinue the IV. Now I'm just going to put some gloves on. I'm going to remove the tape from the tube and discard that. Now I'm going to pull the tegaderm off. Parallels while holding on to the IV site. Then I'll grab a gauze and apply pressure to the site while I remove the needle catheter. Now while I'm holding on to that, I will just assess to see if it's still intact, if there's any infiltration, if anything is wrong with the needle. Then I'll discard it in the sharps container. And after that, I will just put tape over the gauze site. I'm gonna ask if there's any pain, any discomfort, and I'm also gonna look at the area to see if there's any swelling, any redness, any warmth to touch. Okay, now I'm just going to clear my area. Ask if the patient needs anything, and then going to document. Before I go to document, I will put the patient back into a lying position in a 30-degree angle, with the call lighter within reach, and start to document. I'll let the doctor know. Thank you.